So, hello, Claudia.
Hello.
Let me see. We did had an optimal EFT session, a brief one.
Yes.
A couple of months ago, something like that. Does that sound right?
Sounds about right. Yeah.
Okay. And you were dealing at the time with pneumonia.
Yes.
Okay. And it had peaked earlier. I mean, it had gotten much worse before we actually met, but you had done some things about it, and you'd done quite a bit of EFT, not only by yourself, but also with someone who had high qualifications in it.
Yes.
Okay. Why don't you describe the symptoms that you had at the moment you and I were dealing with it?
There was still some residual restriction in the chest in terms of breathing. There was still a sensation of, I wouldn't exactly call it pain, but difficulty breathing. There was occasionally a very strange sound. It wasn't like anything I've ever experienced before. It wasn't like bronchitis. When you cough, there's a certain sound that goes with it. But it would actually just happen in certain physical spaces. Like if I would lay down, it would make that sound.
Mm-hmm. I think you were telling me that previously your doctor had heard that, and it really kind of alarmed him.
Very much so.
Yeah.
He used his stethoscope to listen to my lungs because I diagnosed myself. I knew I had pneumonia.
Yeah, you're a nurse by background, correct?
Yes.
Yeah.
Uh-huh. And, he listened, and of course I had rails and crackles and so on. And then when I laid down, it made that noise. And he jumped back and was like, whoa. If we were in the hospital, I would call the rapid response, which is the precursor to a code blue, where you have respiratory therapy come and do an emergency treatment because you've got to get the lungs breathing.
Sure.
Yeah. So that was a bit alarming, that he freaked out because he's an excellent physician. wasn't a good thing.
Now, at the moment that you and I were dealing with this, you were not at that peak level.
No.
You had done some other things, including some tapping forms of EFT along the way. And you brought yourself down to, I think you said something like a 4, but you're sort of plateaued there. Do I have that right?
Yes. Uh-huh.
Okay. So what you and I then did was this optimal EFT. If I recall it right, and this has been some time ago now, but I think it took 4 minutes.
Yes.
And there were like 2 rounds of optimal EFT. I just closed my eyes. I actually became you. I brought in spiritual guidance, if you will. We call it metaphorically the unseen therapist coming in. Mm-hmm. But it's a spiritual guide that has far more intelligence than I'll ever have, and knows more about what's going on than I could possibly know myself. Mm-hmm. And so I bring that in. The idea is, as I become you, since we're all one, that's easy to do. Okay. Mm-hmm. I'm just you. And so come on in and take care of these lungs, do whatever needs to be done. If there are emotional issues behind it, which are always likely, instead of me having to ask you a bunch of questions and play detective and get down to specific events and go into things, which might take 2, 3, 4, 5 sessions.
Yes.
Maybe a week or 2 or 3 or something like that.
Yes.
It's hard to know for sure. But I just did that twice. And if I recall it, your symptoms just vanished.
They did.
And
I tested the breathing, and I couldn't feel anything unusual.
Okay. And I called you back a month later, and you said, because I'm always suspicious, about instant cures like this, because I always want to test and test and test, are they temporary or not? But it wasn't temporary. It just flat out was gone.
Yes.
okay, in 4 minutes. So, okay, the point I want to make on this, and please give your thoughts about it, is that using EFT, the tapping form of EFT, could probably have done the same job. Probably, we don't know for sure, and we don't know how long it would take, but it would probably take a fair amount of digging, detective work, and so on to get there. Okay. This just cut right through it. I mean, that's the way I see it. It's a parallel to other things I've seen happen like that, but give me your thoughts on that, because I know you have EFT experience as well as optimal EFT experience.
Yes, it did. It went right to it, cleared it immediately within that very, very short time frame, because I had done EFT myself, on myself, and with a practitioner who's very, very knowledgeable. And yes. Yes.
Voila. Okay. One of the things that is unknown here is, what was the emotional cause or other cause or whatever? What was it unseen therapists saw and did that wasn't apparent to us or on the table at the moment? And that's one of the values of bringing in the unseen therapists, because some of these things that are just outside of our awareness are not outside the awareness of the unseen therapist.